Greg DeGier with the ARC and United Cerebral Palsy California Collaboration, and also appearing today on behalf of the California Council of Churches Impact in support of the bill.
Carol Sewell from the California Commission on Aging in strong support.
Alex Hawthorne on behalf of the California Dental Association, here in support.
Bernadette Ariano on behalf of the California Children's Hospital Association, in support.
David Ford on behalf of the Private Essential Access Community Hospitals, the Alliance of Catholic Healthcare, Adventist Health, and Loma Linda University Health, all in support.
Jennifer Snyder on behalf of the Osteopathic Physicians and Surgeons of California, National Association of Chain Drugstores, and also the California Association of Health Facilities on behalf of their intermediate care facilities for the developmentally disabled, and also custom wheelchair providers, all in strong support of the bill. Thank you.
Teresa Stark with Kaiser Permanente in strong support.
David Gonzalez on behalf of CAPG in strong support.
Alfredo Medina on behalf of Western Dental and Ultimate Health Services, also in strong support.
Sarah Phlox, California Labor Federation, in support. Thank you.
Bob Ackerman on behalf of 3 provider organizations, the California Radiological Society, the California Society of Pathologists, and the California Association of Medical Product Suppliers. Thank you.
Brian Warren, California Pharmacists Association, in support.
Sean South, California Primary Care Association, in support.
Tim Madden, representing the California chapter of the American College of Emergency Physicians, the California chapter of the American College of Cardiology, and the California Society of Plastic Surgeons, all in support.
Kathy Dressler on behalf of the Children's Partnership, Children's Defense Fund, Children Now, the California Coverage and Health Initiatives, United Way, and PICO California, all in support.
Shannon Smith Crowley, representing just the American Congress of Obstetricians and Gynecologists for California. Thanks.
Paul Neprath, representing Planned Parenthood affiliates of California and 115 health centers throughout the state. We're in strong support.
Cindy Hillary on behalf of the 34 rural counties, in support.
Chris McKaylee on behalf of the California Ambulance Association, in strong support.
Teresa Anderson on behalf of California Academy of Physician Assistants, in support.
Dolores Duran Flores with the California School Employees, in support.
Fred Main on behalf of CalPACE, the 11 programs for the all-inclusive care for the elderly, in support.
Matt Reese, Mayor's Memorial Hospital, Fall River Mills, California, in support.
Laurel Mildred on behalf of the California Association for Adult Day Services, on behalf of California's 246 CBAS centers, we strongly support.
Catherine Austin Scott on behalf of the District Hospital Leadership Forum, in support.
Doug Chiapet on behalf of 5,000 Union of American Physicians and Dentists, in strong support. Thank you.
Kathy Mossberg, California Family Health Council, in support.
Well done. Well done. Any further witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Questions or comments from the committee? Ms. Burke.
I have a lot to say today. I really want to thank Assemblyman Bonta, and thank you, Chair. I think this is a sound approach to improving access to health care for all communities, and when there is an opportunity, I would like to be added as a co-author.
Thank you, Assemblyman Burke. Mr. Ridley Thomas.
I just want to thank your conscientious work, Mr. Chairman. We know that this is imperative for all communities in California. I want to thank our witnesses, and we are standing with you in solidarity. We represent portions of a medically underserved area, as you know, and to get our healthcare system working, ensuring the right to care for all and uninsuring the uninsured, filling our critical care need, and making sure when you have an insurance card that you can actually get quality healthcare services is all wrapped up in this proposal. So thank you for your efforts and your leadership.
Thank you, Assemblymember. Mr. Rodriguez.
I also want to thank the chair for bringing this very important bill forward to have better access and opportunities for the folks to get better reimbursement rates or better access to care. And also with that, I would like to also be added as a co-author on your bill as well. Thank you.
Thank you, Assemblymember Rodriguez. Mr. Wood.
Yes, I just want to thank the Chair for his leadership on this really critical issue. Representing a substantially rural district, it is even more of a critical issue for us in those areas. Very, very challenging to get providers of any kind, let alone those who can accept Medi-Cal. So the foundation for people being successful in society is good foundational health care, and you cannot be a good student in school if you're not healthy. You cannot be a good part of the workforce if you're not healthy. And there are a lot of poor folks out there that really rely on this service, and we need to do justice by them. And I thank you very much for your leadership.
Thank you, Assemblymember Wood.
Mr. Lackey.
As all my colleagues have clearly stated, we're all very appreciative of the fact of the leadership you've shown here on a very stark and very critical issue. In my district, we have so many people who are in a rural environment who are unable to get the proper care that they desperately need because these rates are so low and the services are just clearly unavailable. So thank you for bringing attention to this very, very important issue.
Thank you, Assemblymember Lackey.
And I, too, want to echo what all my colleagues have said here. Thanks to you for your leadership, Mr. Chairman. To all the organizations that came up and testified, thank you that you keep pushing on this. This is something that from District 1 through 80 in this state, we all represent a pretty diverse districts. But I think the one thing that we have in common is the importance of this issue. I mean, all of us here are united, I think, on that. And so this is critical to California's future. And I appreciate you bringing this. Already proud to be a co-author on this. But this is something that very pleased to support.
Thank you, Mr. Chair.
With that, Mr. Bonta, you may close.
Thank you all for your kind words. I respectfully ask for your aye vote.
Okay. The motion has been made. Motion and second. Do pass to approps. And I ask the clerk to please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chu? Gomez? Aye. Gomez, aye. Gonzalez? Aye. Gonzalez, aye. Hernandez? Lackey?
Aye.
Lackey, aye. Nazarian? Patterson? Ridley Thomas?
Aye.
Ridley Thomas, aye. Rodriguez?
Aye.
Rodriguez, aye. Santiago? Aye. Santiago, aye. Steinnorth? Thurmond? Waldron? Waldron, aye. Wood? Wood, aye.
11-0. Motion passes.
Assemblymember Brown, we have file item number 22, AB 1237. Yeah. And also file item number 11, AB 614. Whichever one you wish.
Let's go with 1237 first. Okay. Thank you, Mr. Chair. I love it. State hospitals are some of the most dangerous places in California to work. About 90% of the patients served by 5 state hospitals come through the criminal justice system, including one in San Bernardino. Between 2005 and 2012, the number of assaults resulting in injuries of staff at the Atascadero State Hospital doubled, and there are 3,000 assaults per year at Napa State Hospital. A substantial number of the assaults are believed to be committed by malingers. The Department of State Hospitals estimate that between 15 and 20% of their patients are malingers. Malingers are patients who are faking mental illness to avoid being sentenced to prison. We have to do a better job. We have to do a better job of preventing them from being placed into the state hospital system. They are not correctional facilities, and the state needs to do more to ensure that patients and staff are not at risk of assault. AB 1237 seeks to improve the evaluations of defendants who are not competent to stand trial, and thus avoid the admission of additional malingers into the state hospital system. Doug Chiappetta is here to answer questions that you might have on this bill.
Thank you, Ms. Brown. Thank you, Mr. Chair and committee members. Doug Chiappetta, once again, on behalf of the Union of American Physicians and Dentists, here with AFSCME. We are the sponsors of this bill, along with the American Federation of State, County, Municipal Employees, along with AFSCME Local 2620. Real briefly, we represent the physicians in the state hospitals, including the Department of State Hospitals. Over the last 20 years, we've seen a significant uptick in the forensic nature of the population. This legislation is an attempt to try and address people who are coming into the state hospitals. It's a work in progress. We've met with the opposition. There are some concerns, and going forward, we certainly will like to address those concerns. In a nutshell, let me just tell you what happens. When somebody goes before the court, they are evaluated by a contract psychologist and or psychiatrist, and they are deemed one of the following: incompetent to stand trial, not guilty by reason of insanity, and so forth and so on. Then these contractors essentially make a determination as to what state hospital venue that is appropriate for placement. There have been numerous reports, the most recent done by UC almost a decade ago, on the quality of evaluations. It leaves a lot to be desired. It doesn't necessarily capture the forensic nature of the patient that they're looking at and they're examining. So our bill essentially tries to retool the process. We've done this in consultation with the Department of State Hospitals, and we are seeking to instead have the evaluation done in-house by the Department of State Hospitals to assess their ability for placement. And we also want to be narrowing the bill going forward to only deal with the not guilty by reason of insanity population. As I said, we've met with the opposition. We think we all are on the same page. The bottom line is we all want safer residents, safer treatment, safer patient controls, and safer staff in the state hospitals. How we get there might be somewhat subject to discussion. Thank you, and we ask for your aye vote, and I have other supporters here. Thank you.
Kobe Pozzati with California Association of Psychiatric Technicians. As previously stated, with over 92% of the patients in our hospitals, they're on our forensic commitment. Hospitals have become incredibly dangerous. In 2010, one of our psych techs was murdered by one of these patients. This bill simply allows forensic experts, people that have expertise in forensic psychiatry or psychology, to make a determination on who's coming into these facilities. With 15 to 19% of the patients there as malingerers, they're running the roost. They're causing the majority of the assaults on our staff. So with that, we support this bill.
Additional witnesses in support?
Mr. Chairman, members of the committee, Randall Hager again for the California Psychiatric Association. On behalf especially of those of our members who do work in the state hospitals, we urge your support.
Additional witnesses in support? Seeing none, witnesses in opposition?
Margaret Johnson with Disability Rights California. We're opposed to this bill. We understand that there's concerns about the quality of the assessment, so we don't think this is the way to get at it. First of all, the people on the panel would be narrowed to just psychiatrists and psychologists that are Department of State Hospital employees. At least that's our understanding from reading the bill at this point in time. And we have concerns that patients wouldn't get a free or a fair trial if the panels were just limited to Department of State Hospital employees. In addition, it's really confusing about how the pool would be selected, and we would expect that the defense counsel would have to hire experts in most of these cases. In addition, the bill changes the current law to require the defense and prosecution to confer with the SH about the selection of the panels, but it provides Department of State Hospital with plenary power to select the panels. So it just seems like there's not really going to be a lot of fairness here for the defendants who are trying to get a fair trial. And in addition, that would require licensed psychologists to have would repeal the existing law that requires licensed psychologists to have a doctoral degree and experience. It really doesn't seem like people without experience should be performing these exams. And then finally, under the current law, the court can appoint any other expert that the court thinks is appropriate to examine the defendant, but this bill would just limit those to forensic experience. What if the court, for example, needed to order a physical exam or other kinds of general tests, there's no reason that would have to be done by a forensic expert. And then under this bill, the examining psychologist or psychiatrist doesn't have to have a forensic experience while all the other experts do. So it's just really, the bill is just very poorly written, overbroad, and ultimately will end up with the defendant not having a fair trial. Thank you.
Chair and members, Dan Pone for the Judicial Council. We won't have a formal position until later this week, but I did meet with the author staff and the sponsors to relay to them. Our Criminal Law Advisory Committee and our Mental Health Task Force members have both reviewed the bill. They're unanimous in recommending oppose on this year's bill. It is identical to last year's AB 2543, which was held in the Public Safety Committee. Just want to quickly go over with you what those concerns are. Of course, we're sympathetic, and no one would be in favor of anything that would put people at unnecessary risk. However, the bill in its current form does nothing to address that underlying question. We've had conversations with the author, staff, and sponsors. The underlying issue, as I understand it, has to do with the quality of the forensic evaluators. But there's nothing in the bill, nothing whatsoever, that addresses setting new standards, increasing the qualifications, or addressing in any way. What it does is it turns upside down the current process that's been in effect for probably 30 plus years about how court appoints evaluations in cases of people who are believed to be either not guilty by reason of insanity or incompetent to stand trial. It would centralize all of those evaluations to the state hospitals, which creates the potential for further delay in the courts being able to find, because there's going to be a much narrower pool of evaluators that are available. There's nothing in the bill that addresses the qualifications for those evaluators, and the issue of the quality of and training for these evaluators was one of the issues that was discussed in governor stakeholder meetings that were convened last year to deal with significant issues that were being presented in the state hospitals for these very populations. That had all of the key stakeholder groups represented in that process, and we would respectfully suggest that that process is a more appropriate forum before we turn upside down what the longstanding process has been for determining who's fit to make these evaluations. And the final point, I just want to correct something that one of the witnesses said. The court, when the court makes a commitment, if they find a person not guilty by reason of insanity or incompetent to stand trial, they're not committed to a particular state hospital. The Department of State Hospitals is where the commitment goes, and then the department is responsible for making the placement based on the needs of that individual defendant and what the capacity is for the state hospitals. So we just respectfully believe that there are some issues that the bill seeks to address, that it doesn't currently address those in any meaningful fashion, and that we would prefer that the bill not move forward, but instead allow this to work its way out, work its way through the stakeholder process. Thank you.